Hello, class. I hope you're all doing fine. Um, this chapter 20 is about cancer, and there are lots of good information, and hopefully you can um, follow some of the recommendations they are making, and then hopefully you'll be safe and sound for the rest of your life. And that's what this chapter is. You understand it a little bit, and then you can implement some of the suggestions toward the end of the chapter they're giving you, and then you'll be good. So let's go. These are again the overviews. I did not delete these slides, so you can put them down in front of you and see if you understand these concepts and you can recall it or not. So that's why I did for you. Okay, so what is the definition of a cancer? A cancer, your textbook is recalling it uncontrolled cell growth. I like to call it abnormal growth. Okay, that's the definition I would like to give. Abnormal growth or uncontrolled cell growth. Um, Again, in some kind of cancers, what happens, the cells are growing, and then outside of the cell, the extracellular matrix are growing as well. And that cause a lot of problem. So most cancers are a result of cell accumulating mutations that ultimately cause a loss of control over the cell cycle. And we studied cell cycle, the multiplications of the cells, mitosis. So the cells are going into mitosis. They do not differentiate. The cells are going to be same as the previous cells. The daughter cells are going to be same as, I call it, mother cells. Cell cancer lack differentiations. So that's what it means. They do not differentiate. If they are, for example, epithelial cells, they grow to be epithelial cells. If they are muscle cells, they grow to be muscle cells over and over and over. The process by which a cell acquires a specific structures and functions, cancer cells are non-specialized and they look distinctly abnormal. So cancer cells have abnormal nuclei. You will see in a picture the nuclei. By looking at it on the microscope, you will see the nucleus is abnormal. And that's what they do. If they want to do diagnosis to identify a person have cancer or not, they look at the nucleus on the microscope, pap smear. Some of you are familiar with it once. And then what happens in real world, our cells, we talked about this in the past, our cells are constantly dying and growing back. So that death, that programmed cell death, is called apoptosis. I would like to call it program cell death. So what happens in case of cancer? Apoptosis doesn't occur. Just the cells keep growing and growing and growing and growing abnormally. So more than well, and then cell divisions go through opportunity to obtain genetic mutations, and that's what happens. Here it is a normal cells of cervical cancer, pap smear. We talked about it just recently. So these are the normal cells, and you can see them. They have the nucleus is normal, and here is a precancerous. Okay, when you look at the cancer cells like that, then you can tell, and these are of course the cancer cells. Look, the cells are not is pretty much filled with nucleus, and it's very abnormal. That's what now you got to the cancer stage. Okay. So cancer cells have ultimate potential to replicate unlimited, I'm sorry, not ultimate, unlimited potential to replicate. So a lot of times when they want to identify cancer cells, they take cells from anywhere in the body that they think there is cancer. They put it in a dish in laboratory, and it keeps growing and growing and growing, and they transfer to another dish, and they keeps growing and growing and growing. It doesn't stop. Okay, on a molecular level, so as I said in the past, our chromosomes, a piece of it at the end gets cut off anytime that the cells replicate. In case of cancer cells, the ends of the chromosomes are repetitive DNA sequences called telomeres. In a normal cells, the telomeres get shortened after each cycle. Cancer cells are immortal and keep dividing and dividing and dividing. So that's what happens. And then these cancer cells are unlimited potential to replicate. They have an enzyme, it's called telomerase, which they prevent a cell from ever losing its potential to divide. The gene that codes for telomerase is constantly turned on in cancer cells. So cancer cells forms tumors. Cancer cells form tumors. A group of cells is called tumor, and normal cells exhibit contact inhibitions. It means when the cells are touching each other, or when they touch a hard surface, like your rib cage, like your abdomen, their basement membrane, we call them, they stop growing. In this case, these cells, they touch a hard surface, they keep growing. And of course, they invade other organs and other tissues, which will come up and we'll talk about it. So they evade those, and they keep dividing and dividing and dividing. Cancer cells disregard growth factors. So cancer cells disregard growth factors. Growth factors are chemical signals that coming two types, stimulatory and inhibitory, keep dividing when stimulatory growth factors are absent, and they do not respond to inhibitory growth factors. Carcinogenesis is the development of cancer, is a multi-stage process. There are three stages of the carcinogenesis. As you know, genesis, it means formation of cancer. There are three steps, there are three phases. The phase one is initiation. One cell mutates and begin the division, starts dividing repeatedly. And then promotion is the next stage. A tumor develops. The tumor cells continue to divide and undergo more mutations. And progression is one cell gains the ability to invade surrounding tissues. That in most cases, that is too late. That's why you hear a lot from other people, from doctors and so on and so forth. The key things about cancer to detect it early. You can detect it early, you can stop it early at the initiation stage, and sometimes a promotion phase, it can be stopped. But when it's getting late in the game, that is tough to stop. I'm not saying it's impossible, but I'm saying it is tough to stop. Here it is, it's showing you the stages. The important thing that I would like to a little bit focus on it, here are the lymphatic vessels and your blood vessels right here. So what happens that you have a mutation in one cell, and then of course the new mutation arises, cells shape changes, and then the nucleus shape changes, and so on and so forth, and the cells mutate more and accumulate. And what happens now, they are, now that it's getting too late, it starts in invading surrounding tissues, and by the time it gets to the lymphatic vessels and blood vessels, of course they are the highways of the body. They take these bad cells to the rest of the body, and it's called metastasis. And then that's late a little bit. So cancer cells undergo angiogenesis and metastasis. So angiogenesis, it means formation of new blood vessels. So if you have a big clump inside of the body, a big lump, these blood vessels, those cells need nutrient. Those cells need food. They need oxygen. The carbon dioxide from those cells must be transported out. So angiogenesis, it means formation of blood vessels. And there are some cancer therapies, they try to block those blood vessels. If they can't block those blood vessels, then you have some success. Metastasis, That is something I already mentioned. It is the cells cross the basement membrane. I talked about that. They go over the basement membrane and then invade. And you already know from chapter 3 or 4, you already know what basement membrane is. Invade blood and lymphatic vessels and form a new tumor. So they go to other organs of the body. Cancer results from a gene mutation. We already talked about that. In the cell cycle, we talked about it. There are checkpoints. So it stops the cell from growing anymore. I'm not talking about apoptosis. Apoptosis means cell death, normal cell death. And then what happens with cancer cells, they are not just, it's like passing a red light, okay? So they're passing these red lights and they're moving and multiplying and multiplying and multiplying. In the cell cycle review of cell division, we talk about it normally. Cyclin directs the movement of cell through the cell cycle, each checkpoint specific factors such as DNA, and we talked about it, mutation in these checkpoints cause the cell to lose control over cell cycle and is resulting in cancer. Okay, cancer results from a gene mutation. So cancer results from gene mutation, and there are two classes of checkpoints: the proto-oncogenes and tumor suppressor genes. These will come up later on during chapter. So let's get a good understanding of what is a proto-oncogene and tumor suppressor genes, like P53 and RAS, and they all come up. There are only a handful of them. You should know 3 or 4 of them. You should know. So the proto-oncogene, it's a gene that codes for proteins that promote the cycle and prevent apoptosis. So that is called, promotes the cell cycle. The cells keep multiplying and as I talked about it earlier. The cells keep multiplying and multiplying and multiplying, and apoptosis does not occur. Cell death does not occur. So we have accumulation of cells, a lot of cells. That is called proto-oncogenes. Oncogenes, it means oncology, it means study of cancer, and that's what oncogenes are. They are genes within our body that they have the ability, if they're turned on, they have the ability make the cells to multiply and multiply and multiply. And then we have tumor suppressor genes. The name applies, very nice name they picked for it. Tumor suppressor genes, they code for proteins that inhibit the cell cycle and promote apoptosis, okay? So these two are responsible for cancer, to stop the cancer, okay? To stop carcinogenesis, if that's the term. So let's talk about proto-oncogenes. When proto-oncogenes mutate, remember they're good genes. And when they mutate and they become cancer-causing genes called oncogenes, okay? So even though we possess 2 copies of each proto-oncogenes, only one must mutate and lose control of the cell cycle. See, in your body, you have 2 genes, A, if you guys can see that, reflection of light, A, or small a, right? So what happens if one of them is mutated, then the other one doesn't care, the cells is mutated. It just takes one allele, and that's what I mean, one allele. This is an allele, capital A is an allele, and a small a is an allele. Together, they are a gene, okay? Together, they are a gene. But anyhow, so even though we possess 2 copies, capital A, small a, okay, capital A, small a, proto-oncogenes, only one must be mutated and lose control of the cell cycle. Okay, some proto-oncogenes code for growth factors or their receptors proteins, and when these proto-oncogenes become oncogenes, receptor proteins are easy to be activated, as they are showing you in here. So the end cells are the end product, not the end cells, the end products, proteins that overstimulates the cell cycle. So here are stimulating growth factors. They're stimulating growth factors. They send signals inside of the cell. It goes to DNA. This is DNA right here. And then, of course, DNA keep multiplying these protein molecules. The code, this oncogene, it's coding for these protein molecules. I know we didn't talk about protein synthesis in great detail. So what happens, these protein molecules, they get out of the cell and they go to the next cell and cause the next cell to be multiplying and multiplying and multiplying. That's what the oncogenes are turned on based on these stimulating growth factors. Stimulating growth factors could be a lot of things like X-ray, ultraviolet light, the chemicals, tobacco, alcohol. So it's a variety of things, whole bunch of things in the environment. And then we'll talk about those a little bit at the end. Well, as long as you know this diagram. So when I talked about carcinogenic materials, so you know what I'm talking about. The steps are right here. Okay, proto-oncogenes becomes oncogenes. So proto-oncogenes becomes oncogenes continue. Several proto-oncogenes code for RAS, important names that you should know. RAS proteins that promote mitosis by activating cyclin. Okay, I think we did talk about cyclin a little bit before. So RAS oncogenes are typically found in many types of cancers, and cyclin D is a proto-oncogene that codes for cyclin. When this gene becomes an oncogene, cyclin is readily available at all times. Tumor suppressor genes. So the second group, remember A, B, I talked about it. So this is the B from previous slides, if you would. The proto-oncogene was A, and we talked about it a little bit. Now these are tumor suppressor genes. When tumor suppressor genes mutate, their products no longer inhibit the cell cycle or promote apoptosis. Same thing again. Unlike proto-oncogenes, both copies of this gene must be mutated. So right here, capital A must be mutated and small a must be mutated, unlike proto-oncogenes. Okay, that's a big difference. So both of these must be mutated. Proto-oncogenes, only A, capital A is mutated, then we got a cancer. Unlike proto-oncogenes, both copies of okay. This is a mutation of the tumor suppressor gene BAX. So gene BAX, if you would, it's a so when BAX mutates, apoptosis is less likely to occur. This product of the protein BAX promotes apoptosis. Okay, right here, inhibiting growth factors, if you would, then it eventually turns on some chemicals inside of the cell, and then protein that unable to inhibit cell cycle or promote apoptosis. So right here, inhibit the cell cycle, and then of course it promotes cell cycle or promote apoptosis. So tumor suppressor genes inactivate tumor suppressor genes protein P53, very important. You probably have heard of it in your life. If you have not, if you're going to biological sciences, you will hear P53 a lot. P53 activates DNA repair enzymes and turn on genes that stop the cell cycle. Okay, that's what the function of P53 is. Many tumors are lacking in P53 activity. And then if you are Houston, we've got a problem. The breast cancer genes, BRCA, BRCA, they call it BRCA1. I don't know if I want to use that term, BRCA1 or BRCA1, or I like to call it BRCA1. That's the gene that codes for DNA repair enzymes. Mutations keep the body from recognizing DNA damage, so cells progress through the cell cycle. And that's what happens. People who have breast cancer, they are looking for mutation of these genes. Oncology, again, in the middle of your chapter, he's talking about oncology, study of cancer. Oncology is medical specialists who go to medical school, and for their specialty, then they go to oncology. And the patient's prognosis, probable outcome, depends on whether the tumor has invaded surrounding tissues, whether the area is metastatic tumor in distant parts of the body or not, at what stage of the cancer. We talked about it: initiation, promotion, and the last stage, which are right here, then to the rest of the body. The term prognosis, I would like you to know that. That means right now a person is diagnosed with, I use COVID-19 for now, has nothing to do with cancer. Just quickly, I want to identify these terms. So you've been diagnosed that you have COVID-19, God forbid, that I have COVID-19, I have the virus COVID-19, okay? So that's diagnosis. Prognosis means what happens in the future. That's what prognosis means. So Amir, this is a possibility. You're going to have respiratory fail. You're going to lose your another prognosis. You're going to lose your sense of taste and smell for a week or 2 or 3. It will come back. Third one, Amir, you're going to die. Those are all prognoses. So different possibilities of what can happen in the future. Diagnosis is what you have now. Okay, you have the virus. Diagnosis for the, let's go back to cancer. Diagnosis is what you have now, what stage it is. Prognosis, it means these are the possible things can happen. Okay, we can treat it, we can radiate it, we can use chemo. Death, you have 6 months, 5 months, whatever it is. Okay, so types of cancer. Tumors are classified according to their place of origin. I would like you to know this, very important. Carcinomas, I should slow down a little bit. Cancer of epithelial tissues, and you know what epithelial tissues are: squamous, cuboidal, columnar. So the skin, breast, liver, pancreas, he's giving you examples, lungs, prostates, and thyroid glands. And then sarcomas is a rise of the muscles and connective tissue. That is, bone and fibrous connective tissue can undergo irregular multiplications. Okay. Then tumors are classified according to the place of the origin. Leukemias is a cancer of blood. You've heard of, probably have heard of that. Lymphomas is a cancer of lymphoid tissues, and blastoma, which possibly you have not heard too much of it, is the cancer composed of immature cells. Okay, the cells are immaturely dividing and dividing and dividing. That is the one you probably have not heard before. Okay, common cancers. I'm not sure if I want to go into spend time on these guys, but they're important. Please read them. It's just common sense. He's saying lung cancer, happened in respiratory tract, and then again, for the exam, I will not ask any numbers. How many percent are getting lung cancer? How many percent are this and that? Colorectal, colon and rectum cancer is another common cancer, and other digestive systems. So again, cardiovascular cancer, cancers in leukemia and plasma cells, tumor, lymphoma, Hodgkin's or not Hodgkin's lymphoma. Your textbook gave it a different term. I like to identify it like this. Please make sure you study these and my PowerPoints. And then Hodgkin's lymphoma is Reed-Sternberg cells are present, then is called Hodgkin's lymphoma. The non-Hodgkin's it means the cells are not present, a type of white blood cells. And what is a Reed Sternberg cells? They are a type of white blood cells. Okay, so And then if you have them present, they look at your cells, and then thyroid glands and so on and so forth, common endocrine system. Most common reproductive category is breast cancer, prostate cancer. You already know that. Urinary system include bladder and kidney cancer, skin cancer, melanoma, and basal and squamous cell cancer. Okay. So causes and prevention. So maybe this would be an interesting portion of the chapter. What are the causes so you can possibly stay away from them, and then the preventions follow up. Cancer mortality, again, I'm not too crazy about these. Well, it's good that you know the lung cancer, the record high, and then again, lung cancer here is a record high in female and male, I'm sorry, and female. But again, well, just look at these graphs and appreciate them. Okay, inheritance. Yes, one of the causes of the cancer is inheritance. BRCA1 and BRCA2 breast cancer susceptibility gene 1 and gene 2. So tumor suppressor genes, both copies of BRCA1 and BRCA2 need to be mutated before the predisposition to cancer is increased. So women who have these genes and doctors look at them, they do a gene test on your genes, and they have them. So they give them, do you have the genes? So what you're gonna do about it? One of the option is heredity. Another one, I will talk about those options, I guess, later on. RB gene, tumor suppressor gene causes retinoblastoma. It's a problem in the eye. It causes in childhood usually a retinoblastoma affecting a single eye is treated, and removal of the eye is the only way. Total removal is more likely to be results in the cure. Here is inheritance of retinoblastoma. He's talking about what can happen and so on and so forth. I'm going to move on with your permission. An abnormal RET gene, which predisposes an individual to thyroid cancer, can be passed from parent to child. RET proto-oncogene, only one mutation is needed. So it is proto-oncogene increases the predisposition to cancer. The remainder of the mutation necessary for thyroid cancer developed in acquired and not. Okay, so he gave you a few genes based on inheritance. Now the environment, what we get from environment, can turn on those genes, possibly, or even without those genes, normal person, still some of the genes can be turned on based on the environment. Mutagens, you probably have heard about it before, an agent that causes mutation. And I already gave you a few, just like ultraviolet light from sun, X-ray, then the chemicals, that carcinogens, chemicals that cause cancer by being mutagenic. Okay, some cause only initiation, other use causes initiation and promotion. Remember the 3 stages: initiation, promotion, prolongation. And hereditary can predispose a person to cancer, but whether it develops depends on the environment. Mutation. Radiation can cause it's a mutation, and I talked about that. Radon gas, nuclear fuels, X-ray, ultraviolet light from sun, the UV rays from the sun can cause skin cancer. Tobacco, of course, the greater exposure is more likely cancer. 80% of the cancer is related to the tobacco use. When smoking is combined with drinking alcohol, the risk of these cancers increases. Okay. Passive smoking, inhalation of someone else smokes, is also dangerous. Here they are, the charts and everything, cancer death attributed to smoking. Again, there are different parts of the respiratory system, and of course the rest of the body that are exposed. to the cancer. Pollutants such as metals, dust, chemicals, or pesticides can increase the risk of cancer. The asbestos, nickel, the people who put drinks in the nose, in the lips, usually is made up of nickel, radon gas, and vinyl chloride, and benzene. These are all chemicals that can, some of you are not familiar with benzene. You probably do not get exposed to it too much, but asbestos was used for the colors, and lead was used in color. But anyhow, in paint, what I mean, color paint. Viruses, some viruses definitely can cause cancer. And now for some of them, vaccine is available, like hepatitis A, hepatitis B. HPV is a human papilloma virus, recently came out, I think 10 years ago. For people who are sexually active, usually nowadays the parents take their teenage daughter to have this vaccine. This is also vaccine. There is also a vaccine for this. And Epstein-Barr virus causes nasopharyngeal cancer as well. Again, continuing on cancer, HTLV, human T cells, lymphotropic virus type 1 causes hairy cells leukemia. HIV, it can cause some kind of cancer. And then, of course, HIV has its own story. You already know, we talked about it, but it also can cause cancer cells. Dietary choices, yes, a high-fat diet or obesity can cause breast cancer and prostate cancer. American Cancer Society recommends consumption of fruits and vegetables, whole grains instead of processed food. Processed food like corn chips you eat, potato chips. These are all just an example. Candy bars, they're all examples of processed food. They would like to say that the food that we eat should be cooked in our kitchen. It's more healthier than it's cooked as a processed food. Anyhow, and limited consumption of the red meat. Exercise is also I talked about at the beginning of semester about exercise and everything else. Okay, so these are checkpoints, diagnosis of cancer. So 7 warning signs. The American Society of Cancer, 7 warning signs. C, caution, the word caution, and I hope you know this for the word, the word caution for exam purposes. You know what each one means. C is for change in bowel or bladder habits. If you see irregularity, maybe you should see a doctor. Sore in your body that does not heal. That is very important. Unusual bleeding or discharge from your mouth, from your anus, from any part of the body, nose, you have bleeding, then you should go see a doctor. Thickening or lumps in breast and elsewhere in the body, it is recommended once a month. Females should check their breast, males should check their breath. It's not trying to play with yourself, but is checking your body. Your scrotum should be checked, male, in the shower when it's down for lumps. It's very important. Thickening or lumps in breast and elsewhere. Indigestion or difficulty in swallowing. Obvious change in warts or mold. If you keep having warts and moles in the body, maybe, of course, they should be removed and they will check them for you. It's just not they're going to remove them. They have to check it. And nagging cough or hoarseness. So that's another thing for lung cancer, laryngeal cancer, and so on and so forth. Routine screen test, yes, you should do that in case of cancer. The ABCDE test to detect melanoma, and pap smear for cervical cancer, and the age factor is important on these things as well. The ABCDE of melanoma, skin cancer, so asymmetry, borders are important, colors are important, diameter and elevated or not. These are all A, B, C, D, E of melanoma. There are three types of testing for colon cancer: a digital rectal examination, sigmoidoscopy, use of thin, palatable light tube. They go with a light inside of the your colon and they look for any lumps. It is different than colonoscopy, but anyhow, stool blood tests. It detects blood. Anytime that you go to a doctor and they do a rectal exam for checking the prostate, they should also check right there for blood in the stool. All positive tests are followed up by a colonoscopy and X-ray. Okay, blood tests detect leukemia, urinalysis, diagnosis of bladder cancer, and then procedures to detect breast cancer, self-examination in physicians, mammography, X-ray breast. Here is a normal breast, and here are the pink area. It's a tumor in the breast. More routine men. While I'm here, I should mention that male also get breast cancer. It's just not in women. It's in male. It is possible. The percentage is lower. It's less common in male. The statistics is there. You guys can look it up. But male can get breast cancer as well. Period. Okay, magnetic resonance MRI imaging, as you've heard of that. It detects some of the cancers, usually by bone and so on and so forth. Ultrasound visualize tumors, stomach, prostate, and pancreatic cancer, but still for prostate, the best one is the rectal exam. And then biopsies, it means when, of course, the person is alive, they go with a needle and they remove the affected area from prostate or from anywhere else, from bone, and then they look at it on the microscope to see if they, the cells are defected or not. Here is a recommendation of early detection of cancer, and here they are. So it would be good that you guys read it, look at it. Tumor marker tests. So blood test, antigen and antibody. So tumor releases substances that provoke an antibody response in our body. So our body start responding to these tumors, and then of course the antibody. We talked about it a little bit. The Y-shaped protein molecules made by B cells. They go and try to fight them. Okay, our immune system try to fight cancer cells, but guess who wins at the end? That is one of the already had colon cancer. Is possible to test for presence of antigen, and then they call it CEA, which is carcinoembryonic antigen, to detect the relapses. The prostate specific PSA, you go to doctor and you run a blood test and they look for prostate cancers, and CA125 test, and ovarian cancer, alpha fetoprotein, AFP. These are, I'm not too crazy about the name of these things. Genetic test, yes, for proto-oncogenes and so on and so forth. Prophylactic surgery, that's what I was talking about. If the test is available for BRCA1, BRCA1, breast cancer gene or not, some women choose to go ahead, do a prophylactic surgery. They remove their mammary glands in order to prevent someday they might have the cancer, so they remove it now. The term prophylactic, you guys, just the term prophylactic, it means if you take a drug to prevent a cancer, or you take a drug to prevent a disease. For example, people who go to areas that they have malaria, the disease malaria transmitted by mosquito and so on and so forth. They take the medication. So when they go to the area, if the mosquito bites them, then do not get it. That's called prophylactic. So if you take a medication, and in this case, you're doing a surgery, it's like I go remove my prostate. Hopefully, I will not get a prostate cancer. I don't know. That's debatable. That's controversial. So these are prophylactic surgeries. I mean, the person at the moment is perfectly fine. Okay, that's what prophylactic surgery means. The person at the moment is fine, but the genes are in her body, so they choose to go ahead and remove the breast cancer. And as you know, if they get the breast cancer, it can spread out through the body and so on and so forth. You know the rest. So anyhow, can use microsatellite to take chromosomal. Yeah, this is, I don't think these are should be you for your class. I'm not too crazy about microsatellites and so on and so forth. Okay, treatment of cancer, surgery, radiation therapy, chemotherapy are standards methods of cancer therapy. Surgery again, not prophylactic. I'm not talking about prophylactic surgery now. I'm talking about if there is a prostate cancer, they go ahead, they will go in there and they remove the surgery, the cancerous. And then a lot of times when the surgery is done, they will follow up with radiation to kill the rest of the cells that are throughout the body, or chemotherapy with the drugs. Taxol is a drug that they use. Taxol, T-A, oh, come on, Taxol. That's an O. Taxol is a drug they use for chemotherapy. It shows some success in here. So chemotherapy continues. Common types is alkylating agent, block replication of DNA, anti-metabolites, which blocks enzymes needed for growth, and anti-tumor antibiotics, which we talked about it a little bit. Um, Bacterial infections block cell divisions. Mitotic inhibitors inhibits cell divisions like Taxol. I talked about that. And nitrosourease is impede enzymes that repair DNA. Chemotherapy, bone marrow transplant, that's another one. So they take the patient's bone marrow, and then they do chemotherapy on the patients, and then they put this healthy bone marrow, and then after chemotherapy they put back auto transplantations. Right here is used the auto transplant. They put back those cells in the body of the patients, and hopefully it will. Immunotherapy, yes, these are newer therapies. Immune system can slow tumor growth. Some cancer cells can avoid immune system, even though they are different from normal cells, and vaccines against cancer are under development as well. Here is a use of immunotherapy. They're telling you how they go ahead and do this, and uh, antigen presenting cells they take out of the body, and then they grow the antibodies, and then or they manipulate the genes in the body, and so on and so forth. There are different methods are developing right now. Immunotherapy continued, and then P53, that's important. I would like you to know P53 gene therapy. P53 genes expression triggers apoptosis. Okay, so you already know that. And then P53 does this only in cancer cells, and elevating the P53 level in a normal cell does not do any harm. So researchers genetically engineered a virus that infects tumor cells, restore P53 genes functions, and then kill them. Other therapies, anti-angiogenesis drugs inhibit angiogenesis, shrink tumor cells by decreasing the blood supply. A number of angiogenesis are currently being tested. And that's the end of the chapter. You guys, I hope you be healthy, wealthy, and wise.